GLP-1 medications are seemingly everywhere, and I know you've seen the TV commercials. I sure have. And according to some studies, 1 in 8 US adults have been prescribed a GLP-1 medication like Ozempic, Wegovy, Mounjaro, and other versions like Zepbound. That's 12% of the population, and it only seems to be growing. While some will hail this as a miracle advance in medicine, others urge caution and feel the current trend is unsustainable and not the best path for overall health. And that's what I want to discuss today, specifically about a new policy brief from the Coalition for Metabolic Health, CMH. This policy brief was created by a GLP-1 task force, a group of metabolic health experts with knowledge and experience using GLP-1 medications. We convened this task force specifically to help clinicians, patients, and policymakers think thoughtfully about how these medications should be used in the context of not just short-term weight loss, but rather long-term, sustainable metabolic health. Now, GLP-1 receptor agonists are undeniably a major advance in the treatment of obesity, type 2 diabetes, and potentially other metabolic conditions. They significantly reduce appetite and food intake, leading to substantial weight loss. They improve glycemic control, lowering blood sugar, reducing A1C in people with type 2 diabetes, and there's growing evidence that they also improve multiple cardiometabolic outcomes beyond weight, including aspects of cardiovascular health, liver function, and other metabolic-related conditions. So for many patients with obesity and metabolic dysfunction, GLP-1 treatment can be life-changing. But the CMH policy brief makes a crucial point. Despite their power, GLP-1 medications do not cure metabolic disease, and their efficacy requires continued use of the drug, seemingly forever. That's a daunting health challenge. You see, these medications don't address the underlying dietary drivers of insulin resistance and disrupted metabolism. They don't reliably restore metabolic flexibility, the body's ability to shift between burning fat and glucose efficiently. Taking the medications rarely comes with any guidance for long-term off-ramps, what to do if someone reaches their goal or chooses to discontinue the medication. And the medications frequently fail to preserve lean muscle mass, raising concern about body composition changes with long-term medication use. And even as effective as these medications are, in real clinical practice, we see many patients experience weight loss plateaus, side effects, or loss of insurance coverage. Yet when it's a drug-first approach or an all-or-nothing mentality, there's little to no guidance on how to manage these transitions. So a clear gap in current practice is what happens after patients stop GLP-1 therapy. And the research, unfortunately, is clear that most patients regain the weight and lose the metabolic gains after discontinuation. And this is especially true if effective lifestyle habits aren't firmly established. Thus, one of the main themes in the CMH brief is that lifestyle interventions matter, even when medications are involved. They are not mutually exclusive. Effective dietary approaches, particularly low-carb and ketogenic diets, have ample evidence showing they can improve insulin resistance, reduce appetite, support weight loss, and even help people avoid or discontinue weight loss medications entirely. These diets often mimic one of the main effects of GLP-1 drugs by reducing hunger and cravings, but without the need for lifelong pharmacotherapy. Comprehensive lifestyle changes also help with body composition, metabolic flexibility, and long-term health in ways that a single drug rarely does. So effective, structured lifestyle interventions can help maintain metabolic gains after GLP-1 discontinuation and address challenges like muscle and bone loss, side effects, and high costs. That's why the CMH document supports responsible stewardship of GLP-1 medications. That means recognizing GLP-1 drugs are powerful tools for certain patients, particularly those with significant obesity or type 2 diabetes, but rejecting the idea that lifelong pharmacotherapy should be the default solution for metabolic dysfunction. That means integrating GLP-1 medications within a broader evidence-based care plan that includes diet, exercise, behavior change, and proactive planning for eventual medication taper or discontinuation. Lifelong medication should not be the default goal for everyone. And that helps turn the focus to prioritizing durable metabolic health, not just short-term weight reduction. The bottom line is that GLP-1s are potentially very helpful tools, but not default answers. If we elevate GLP-1 medications as the only pharmacologic answer to complex metabolic diseases, we risk ignoring lifestyle interventions that improve long-term outcomes. We risk promoting indefinite medication dependence and overlooking metabolic resilience and quality of life. But when GLP-1s are used thoughtfully as part of a strategy that includes metabolically guided nutrition, physical activity, behavior change, and metabolic education in general, they can be powerful partners in transforming metabolic health. That's why the Coalition for Metabolic Health's GLP-1 Task Force created this document to encourage thoughtful, patient-centered use of these breakthrough medications. I encourage you to check out the full policy brief at our website, coalitionformetabolichealth.org. And please let us know your thoughts in the comments. We'd love to hear from you. So thank you for watching. I hope this was helpful. I'm Dr. Bret Scher, and we will see you here next time at Metabolic Mind, a nonprofit initiative of Bazooki Group. Thank you for watching. If you want to see more, check out these recommended videos. Also, if you haven't already, don't forget to subscribe to our channel to stay up to date with our content and help us expand the movement. And if you want to sign up for our newsletter, access our resources, read the latest research, or check out the Think Smart framework, click here to visit our website. See you on the next video.